Dangerous effects of Apetamin you should know. Across the globe, several people use dietary charts, food supplements and join a regular gym for losing weight. Conversely, some individuals use pills and syrup to gain weight. Meanwhile, an American-based model and businesswoman Kim Kardashian formulated a syrup, Apetamin, for gaining weight. Due to its several side effects, it's banned in major countries like the US and UK. Although it's an unproven drug, still some people buy it from online stores or illegal sources. In today's video, we will discuss the side effects of Apetamin. But before we get into the video, make sure you have subscribed to our channel. Apetamin is syrup prepared by Indian-based pharmaceutical company formerly called vitamin syrup for weight gain. Detail mentioned on its label show it has several ingredients including vitamin B1, vitamin B3, detxaphentol, and pyridoxine, cyproheptadine, and L-lysine hydrochloride. However, research shows that none of these is an appetite stimulant for humans that are normally used in weight gain pills. So let's look at its side effects. 1. Liver failure. Apetamin is a hunger stimulant, but medical experts said that none of this combination is linked with appetite. Even you can't trust for detail mentioned on the labels of Apetamin which mean to promote liver health, as it has caused liver problems in many users. Although not all cases are documented, few people even with acute liver problems or with no sign of liver problem experienced severe toxicity in the liver after use of Apetamin. For example, 29-year-old women developed jaundice and 55-year-old women suffered from acute liver failure after consuming a trial dose of Apetamin. In some cases, the patient died soon after consuming Apetamin. This has mighty scientific reason. Using unregulated can upsets our metabolism and digestion. Both of these processes are important for liver health, and any problem in immune disruption or metabolic disorder can cause liver damage. 2. It will cause obesity in average-weighted person. Cyproheptadine with other vitamins is considered as an appetite stimulant in underweighted and malnourished children having problems with their eating pattern or digestion. Normally, cyproheptadine is used to remove allergic reactions. A study conducted on 499 people showed that 73% of users of cyproheptadine were at a risk of obesity. Its mighty reason is that it may increase your appetite hormone called ghrelin and suppresses leptin. Leptin hormones send a signal to the hypothalamus that gives you a feeling of fullness. When your satiety hormone is suppressed, your brains can't interfere and regulate your food intake. Consequently, you keep on eating but you don't feel that your stomach is filled with a lot of food. Ideal caloric intake in normal young men and women ranges from 1,500 to 2,500 calories. But research shows that when you use Apetamin you may cross this limit, and as a result, your whole body will store a lot of fats per day. 3. This syrup will lower your self-esteem instead gaining. Some female users of Apetamin believed that it will help give them gain weight in certain body areas like thighs, breasts, and butts. This doesn't make any sense, as the fats that your body absorbs don't only get stored in thighs or buttocks, but in overall body. Fat mass distribution is different in different people. It's possible that after using Apetamin, your midline gets more fats or you get a bulging tummy. You don't know where your body will preferably store your fats. So, don't expect a curvy figure after consuming Apetamin. Models or actresses you had their results after using Apetamin might not be a true story and just a marketing tactic. Having an irregular body shape can lower your self-esteem and give you depression. Exercise of a particular body part, however, can bring the desired results. 4. Dizziness. While dizziness is like a common side effect of every other drug, it's different for Apetamin users. Several Apetamin users complained that right after use of this drug, they felt sleepiness and tiredness. Also, in a long run, when you raise your calories than your normal routine, your major body organs work hard and release extra hormones to break down a lot of complex food particles. As a result, your metabolism speeds up and a lot of chemical reactions will happen in your body. This will make you feel sleepy, tired, and sometimes you may feel that you can find difficult to focus on anything as your body is busy with digesting food and your brain is engaged as well. 5. Change in circadian rhythm cycle. Apetamin intake not only makes you obese, but also disturbs your sleep as well. For this, you must understand some scientific facts about the sleep-wake cycle. Hunger, eating, and metabolism are greatly linked with our sleep. In all humans, sleep-wake cycle or internal master clock of a body is called circadian rhythms, and it decides when to sleep and when to awake. Let's see how overeating interferes with our sleep pattern. Consuming more and more foods constantly will enhance your metabolism and also create an overall imbalance in appetite hormones leptin and ghrelin. Fall in leptin level and rise in ghrelin suppresses our sleep hormones called melatonin. Several studies show that level of ghrelin falls in later hours of the night, and thus it helps us to fall asleep. Another study shows that 30% individual who sleep less than 6 hours of night were found to have an imbalance in metabolic regulation and hormones. However, this apetamin intake disturbs the internal clock of our body by causing an irregular release of different body hormones that are associated with our sleep-awake cycle. 6. Heartburn. As we have already discussed, cyproheptadine hydrochloride together with other ingredients enhances the desire for more calorie intake than the normal routine. This unusual and sudden overeating creates stomach upset. For example, when we eat, our stomach releases hydrochloric acid to digest food. For we eat more food, our stomach releases more HCl to break down complex food particles, and a huge quantity of HCl than normal routines will cause heartburn and might make your food pipe a little acidic by acid reflux. Also, an increased level of hydrochloric acid creates bloating, vomiting, and may cause stomach ulcers. 7. Bloating and stomach upset. Apetamin intake will boost your food intake, and without any doubt, this process physiologically expands the size of your stomach to hold more food. Stomach enlargements causes more urge of eating to fill space within the stomach. Normally satiety signals are released after 20 minutes of food intake, but since apetamin stops this hormone from working, you won't be able to stop eating. When your stomach has more food in it, it's less likely that food will be completely digested. Your stomach can pass undigested food to the intestine. This will obviously result in gas production by the bacteria sitting in your gut and hence cause bloating. 8. Reduces your brain function. Apetamin is an unregulated drug, and several users claim that they had foggy memory after using this drug. As apetamin promotes excessive intake of food, studies show that binge eating lowers our brain function. Its active ingredient cyproheptadine may also block the release of serotonin hormone or interfere in its function. Serotonin is called a happy chemical, and it keeps us away from depression and plays a vital role in maintaining our brain health. So low levels of serotonin can cause anxiety, depression, and sleep disorders. Where globally depression is affecting 264 million people, you might be inviting depression by using Apetamin. Once you catch depression and sleep disorders, it takes months and sometimes years to heal. 9. Imbalance in microbiomes. The key compound of apetamin is cyproheptadine, which is antihistamine. Histamine is a chemical that triggers allergic reactions in our body. However, without having an allergic reaction, blockage of histamine can imbalance natural microbiomes of our body. These microbiomes consist of 1,000 different types of bacteria, and they influence our body in several ways, either by producing nutrients like vitamin K, storing fats, and build strong immunity against foreign genes. Any imbalance in the microbial ecosystem can lead to asthma and inflammation of urinary tract infection. A number of patients who have been using this drug suffered in urination and had constipation or sometimes diarrhea. 10. This will take years to recover. Apetamin users may get long-lasting dangerous effects and it takes years to recover. Successive addition of more calories for several weeks will produce fats in the vital abdominal organ like intestine, kidneys, liver, and in all parts of the body. An accumulation of visceral fats in your body may trigger other chronic diseases like cancer, liver failure, cardiovascular disease or general inflammation in joints. Remember that the use of apetamin might create an imbalance in your key hormones, and such imbalance itself causes several ailments like inflammation, allergy, sleep disorder, depression, liver failure, loss of memory, and obesity. Let us know in the comment section if you've ever tried any weight gain technique that worked. Hope to see you soon in another video.